Many patients with cancer come here to the Champalimaud Foundation in Lisbon, Portugal, to take advantage of the latest technologies in radiosurgery. Let's find out what that is.
This technology is called high-precision radiotherapy or radiosurgery. An electron accelerator directs a beam of photons, a virtual blade, towards the tumour, a modern version of X-rays. What has been improved in these new machines is the accuracy. The beam hits the tumour with a precision of just 1 millimetre. This non-invasive technique speeds up treatment, meaning some tumours can be treated in just a few sessions. The Champalimaud Foundation in Lisbon is a non-profit organisation focusing on the research and treatment of cancer. This year they expect to treat around 15,000 patients. Across the 28 countries of the EU, 400,000 men are diagnosed with prostate cancer each year, with a mortality rate of 20%. Professor Carlo Greco is a radiation oncologist who has worked in Italy and the US. He introduced new technologies to improve precision, including a distant relative of the GPS systems used in many cars.
This is a tracking device, much like a GPS. It will tell us what is currently happening as the treatment is being delivered, and it will allow us to track motion and correct it so that the deposition is with a high degree of accuracy. Through the prostate is a structure which is the urethra, through which the urine passes, and with our technique and with the tracking that we perform during the treatment, we can selectively spare this structure so that the side effects of the treatment are truly minimal.
In this room, researchers are studying treatments for lung cancer, of which there are also around 400,000 new diagnoses per year in the EU, but the mortality rate is approaching 85%. Professor Greco says the technologies used for different tumours are based on the same principles.
Before we do the treatment, we acquire a CT scan of the patient in treatment position. We can actually see the volume, the anatomy of the target, the prostate in this case.
And is this technology cost effective?
It is more cost effective because we can reduce the number of sessions significantly. Typically, we treat prostate cancer in 5 single sessions, and in some cases, we treat primary disease in 1 session only, meaning that treatment is delivered in 1 single exposure of radiation, of high-dose radiation, with huge advantage in terms of convenience and comfort for the patient.
In the garden of the Champalimaud Foundation, we meet José, a prostate cancer patient who had an early-stage cancer that was treated in only 1 session.
I was diagnosed with prostate cancer, so my son made an appointment for me here at the Champalimaud Foundation. When I arrived, they offered me radiosurgery, which is what I did. It was like having an X-ray or a scan. I felt no pain or discomfort, nothing, and now I feel good.
Unfortunately, not all patients have the same luck, and there is still a lot of research to be done into cancer treatments. But precision radiosurgery is a big step in the right direction.